Hello, I'm Dr. Jim Hutchins, and I'm the optometrist at Lifetime Eyecare Center in Sleepy Eye, Minnesota. Lifetime Eyecare Center has been in Sleepy Eye for 32 years. The way that we provide eye care here is unique. My optical staff are very skilled at making you see well and look really good. A big part of our practice is prevention. You can prevent many eye diseases and needless vision loss. We spend a lot of time educating the patient why it's important to have eye care. For example, we take the time to make sure that everybody understands what it is we're dealing with. It's been very gratifying, the number of people that believe in this and come in for routine eye care and leave often without any eyewear, but they have made sure that their eyes are healthy. That's the most important reason for having routine health care, is to make sure the eyes are healthy. We have the most cutting-edge equipment and techniques. We would take an image of the inside of the eye through the pupil. No x-rays are involved in this. It's just like taking a picture through a keyhole. We also have an amazing instrument that can take a panoramic image of the inside of your eye so that we can see things that ordinarily we would not be able to see unless we dilated you. So many times we can forego dilation. The eye is the only place where we can look in and see blood vessels and nerve tissue without having to do surgery. The pupil is an opening, and we can look in the eye through the pupil. The way the blood vessels look in the eye is the way they look throughout your whole system, so we can often see signs of high blood pressure or hardening of the arteries or diabetes. There's a lens inside the eye. It's hidden, you can't see it, but it is in there, and when we're young it's very flexible and clear, and we can change its shape to rapidly and accurately shift our focus for different distances. So if something comes at us, we have to flex that lens. So when we're doing lots and lots of desk work, paperwork, computer work, we're flexing this non-stop, or we're making this focus effort or accommodative effort all the time. And the eye wasn't really designed to do it as much as we're doing now in the information age, and lots of people this is becoming a problem. They're getting eye strain, fatigue, and headaches. Even young adults sometimes have a lot of eye strain because they're having a hard time handling the work that the eyes have to do to see up close. It can even trip up a child trying to learn how to read and write. We can prescribe a more appropriate prescription for that setting that would be tailor-made for that, where the glasses would do all that work. Learning happens at near point, and many young people are struggling here and nobody recognizes it. We actually provide free eye assessments for 3.5-year-olds because we want to intercept eye and vision problems peculiar to that age that can make or break their lifetime ability to see. Our free assessment involves looking inside their eye, checking them to see if they have a glasses prescription, testing how well their eyes work together as a team, and the child usually enjoys it and thinks that we just played some games with them and it was fun. It takes about 10 minutes. It's very non-threatening. We have an excellent selection of really cool frames. Some people say, well, I can't look at frames because when I take my glasses off I can't see. Well, we have an instrument called a Smart Look, and you can try on the frames and it can take multiple images of you so that you can see yourself from the front, from the side, and so forth. And then once we've done that, you can put your glasses back on and see how you look. It can also show you the difference between an anti-glare coating and not anti-glare and how it would look cosmetically on you. We fit all types of contact lenses. If you've never had contact lenses and you're worried that you might not be able to stand putting it in your eye, don't worry. We could put one in for you so you see what they feel like, and we could help you put one in. Once you realize that you can actually do it, it's all downhill from there. We provide a lot of emergency care. People come in with welder's burn, people come in with scratched eye, people come in with an allergic reaction. We actually get referrals from the emergency room. When the emergency room doctors feel like, boy, maybe an eye doctor should assess this, we recommend that all people have an eye exam at least every year or two to make sure their eyes are healthy. It has nothing to do with if you see well, if you need glasses or whatever. That's important too, of course. But what we're the most concerned about is eye health. That's the main reason you should have an eye exam on a regular basis, no matter what kind of eyes you have.